Dr. Taison Bell, Assistant Professor of Medicine at the University of Virginia. And Dr. Bell, let's just start with the fact that more than 50% of COVID cases in the U.S. are now attributed to the Delta variant. I guess from your perspective, what do you think needs to be done in order to control the outbreak of the Delta variant here in the U.S.?
Well, vaccination for sure. We know that being fully vaccinated is very protective against the Delta variant. And if you're not vaccinated, then you're vulnerable. In addition to over 50% of cases being driven by Delta variant, over half of cases in half of states in the U.S. now report significant increases in cases. And this is going to be regionalized. So states that have high rates of vaccination, even if you see an increase in cases, you may not see that increase in hospitalizations and then deaths because of the protection vaccination offers. But in states that have low rates of uptake, then this can be a really big problem leading into the summer, into the fall.
Dr. Bell, Angela here, really good to talk to you again. Looking at what you just said about the hospitalizations, but we have seen some reports, including that report out of Israel, that the variant is troublesome when it comes to the vaccinations in those breakthrough cases. How should we think about that, especially with no new guidance from the U.S. government on how to handle the Delta variant with no new masking rules, et cetera?
That's a really good question. And as you know, Israel has been a good case study because they were so far ahead of the curve on vaccinating individuals. And a lot of them received the Pfizer vaccine. And they did release that report showing that the efficacy looked a little bit decreased against the Delta variant. They cited 64%. Now, this wasn't in line with many of the other studies that suggest the effectiveness overall is much higher, more in the high 80s and maybe the 90s or so. But I think the most important thing to note is that Israel hasn't seen a COVID-19 related death in weeks. Their hospitalization rates have not been increasing in spite of the cases that they've seen rising in the country. So that still underscores the point that full vaccination is very protective against the Delta variant.
Hi, Doctor. Curious, we're hearing about these new, even stronger variants like the Lambda variant in South America. Is that of concern for us here in the United States? And what can we do, if anything, to prepare for it?
So the Lambda variant is something that we're still learning more about. It looks like it does have a couple of mutations that could give it some ability to escape vaccine protection. But we're going to have to do more studies in order to figure out if that's actually the case or not, and also to determine if it actually of the others that are circulating. It underscores again the importance of trying to vaccinate as many of the worldwide population as possible, because one way that we know that we can protect from variants is to keep the population of circulating virus low. Each time the virus is able to replicate and infect someone new, it's like playing the lottery. And if you have a lot of lottery tickets, eventually you're going to hit the number. And so if we have pockets of the globe that are not protected from vaccination by vaccination, then you're going to eventually see more and more variants. And if you have enough chances, we might have that one that can set us back to square one and escape the protection from vaccine. So again, I don't want to sound like a broken record, but getting as many people vaccinated as possible, countrywide, statewide, and worldwide is really the solution.
And Doctor, at the expense of you, I guess, sounding like a broken record, because I know we talked to so many doctors about this over the last several weeks, but I'm curious just to get your thoughts on what we heard from President Biden yesterday, his efforts now to get the remaining 30% of U.S. adults who haven't been vaccinated, to get them to get the shot. I guess, what do you think needs to be done, or what can be done at this point in order to reach the people that we haven't been able to reach up to this point?
Well, I certainly do think that the traction that we gained from the centralized vaccination effort, that's pretty much gone at this point. And we vaccinated the people that were apt to get vaccinated that way. I do agree with the administration's approach to try to decentralize this process and get it more into community clinics and the doctors' and nurses' hands, into the hands of people in the community that they know and trust. There's a survey released recently that showed that among people that have not been vaccinated and choose to remain unvaccinated thus far, if their personal physician talked to them about it and convinced them, they'd be much more likely to get vaccinated. So we do have to make sure that we get it into the hands of local providers to make sure that we can have these conversations, divorced from all the politics that can be involved in it. The most intimate and personal interaction with the patients, with their physician in most most cases. And to this point, we haven't had a lot of vaccine supply available in actual primary care clinics. So I think that's the next step. And then I think to take it a step further, once we gain full approval from the FDA, which hopefully will happen soon, I think the conversation around mandates for businesses and universities needs to be a discussion to really encourage the last group of people to really go ahead and get vaccinated.
Doctor, talking about treatments, when we're looking, at the individuals who do end up in the hospital, if they do, I know that for the longest time there were discussions about corticosteroids and the effect they had, in addition to, of course, the monoclonal antibody treatments. But now I know the World Health Organization has also been talking about Actemra and Kevzara. Do you have any insight into that? Is that what's being used?
We haven't really been using that therapy much here at the University of Virginia. We've been sticking with remdesivir and steroids, mechanical ventilation when it's needed, high dose oxygen therapy, a lot of the staples. I think the monoclonal antibodies are a very important tool because they have the ability to prevent people from getting very sick from COVID-19. Of course, the variants can introduce a wild card there because you could potentially have ineffective treatments in the setting of that. But the most important thing to do is try to prevent it in the first place, because every person that I treat in the ICU, we're cognizant that that's a preventable complication. We really should not have people getting sick enough to go to the ICU or potentially lose their life in the era where we have vaccines that can really prevent this.
Doctor, very quickly, any benefit for those of us who are fully vaccinated if we were to go and get a booster shot now, whether it be Moderna, J&J, or Pfizer?
I think that literature is evolving. There's some interesting data showing that the mRNA vaccines in particular can induce a very strong immune response that involves not just antibodies, but the cells that produce the antibodies and hold the memory of that response. The J&J vaccine seems to do that too. And so there's that potential that our immunity could last much longer than we initially thought, maybe over a year or even longer than that. I think the variants, again, that could probably introduce another layer of complication here, because if there's a variant that has that ability to escape the immune response, and that does actually set us back to square one. And I think the conversation around boosters will more likely be driven by concern around the variants, at least right now, rather than declines in the immune system, which looks to be very strong from the vaccines.
Dr. Taison Bell, Assistant Professor of Medicine at the University of Virginia, thanks so much for joining us. And of course, our thanks to Anjali Kamlani.